Hello, everyone. Welcome to this topic, infection prevention and control. The purpose of this learning is to provide guidance for a healthcare assistant around the infection prevention and control standard that is required in a healthcare setting. Okay. By the end of this training, this online resource, we believe that you should be able to answer interview questions and have a proper understanding regarding basic microbiology of uh, diseases and infection, the ways in which infection can get into the body, the requirements of healthcare assistants on how to monitor your own personal health, your own personal hygiene, and how to reduce risk of cross infection within your work environment. Okay, you also need to understand the importance of correct hand hygiene technique to use that to reduce the risk of cross contamination. You have to also understand that in the course of your work, there are some common pathogens that you have to be mindful of, such as, of course, the COVID, and how they can be managed in the healthcare environment, how to prevent transfer of COVID, how to keep yourself safe, even after you've had the vaccine, how to make sure you keep yourself safe and people around you safe. There are some standard precautions you need to observe to prevent uh, some hospital-related infection. They are called healthcare-associated infections. Okay, there's some standard protocols in the healthcare environment. So these and other things you are going to be talking about in this training. All right. Uh, it's important that you understand that in the course of this training also, we're going to be giving you a proper introduction, into infection prevention and control. Okay, how you can uh, understand how to demonstrate effective hand hygiene, common types of protective clothing, the PPE, the procedures on how to, for the donning and doffing, that's how to put on your PPE and how to put it off in a safe and effective way, how to safely handle infected, or soiled linen or bed sheets, or clinical waste. Those are some of the things we'll be talking about uh, on this particular training. Okay, this will help you respond to questions during your interview that concerns infection prevention and control. Okay, so why is it important that we take this course? So that as you don't have previous training or knowledge as a healthcare professional, you need to show your interviewers that you are aware of the background knowledge required of you. Okay, this training is tailored in such a way, it's for personal development. It will help you answer questions that come your way during your interview so that you can impress your interviewers and they can shortlist you for the job. All right, the job of a healthcare assistant. Now let's start with what causes disease. Bacteria causes disease, viruses causes disease, uh, virus causes disease, parasites causes disease, and fungal infection can also cause disease. Like we all know, bacteria, is found in the environment, and of course, viruses too are found in the environment. Same thing with fungus, that we see in our environment also. Those ones they live in the air, in the soil, or plant, So these are, what causes disease. Okay, and they could be in the environment, they could be on surfaces, they could be on the equipment, they could be in water, they could be in food, they could even be in the soil. For example, there are infectious agents. They can't survive on their own. So they have to take a host. So, but we're going to be talking about that later. Let's first consider the most important part, which is transmission. How are these diseases transmitted? Okay, this is the method to which uh, there is a transfer of microorganisms from one place to the other. You know, microorganisms themselves, they don't move. Okay, it's something that moves them. It's something that carries them, and that is sometimes it can be by direct contact or by indirect contact. Okay, by direct contact we mean human to human contact. For example, touching, kissing, sexual intercourse, or from a pregnant woman to her fetus through the placenta, you know. Then the indirect contact, is when you have airborne, by coughing or sneezing, like you can see from COVID, where you have to cover your nose. Then there are some from vector-borne, vector, that is a bite from a mosquito, okay? Like the malaria ones you have in Africa, in Nigeria. That's one of our most common malaria. You see, when you get a bite from mosquito, it is not, the malaria does not move from one person to the other by itself. It's a mosquito that from an infected person, they are now transferred to an uninfected person. Okay, so there's something that carries that transmits the disease. Okay, so we also need to consider the site of entry. All right, sometimes it could be whether you put it into your mouth, you ingest it. Basically, I mean, we all know typhoid. Typhoid is caused by whether you've eaten a food that is contaminated, you've drank water that is contaminated. Another mode of entry into the body is through the skin. Sometimes medical devices too can be, if not properly checked, when they're using an infected needle. When a quack doctor uses an infected medical device, or a needle by people who do all these people that take drugs through that inject themselves with drugs. When they share the same needle, you can also transmit HIV and other disease through the sharing of needles, you know and all that. Then through sexual contact too, diseases are transmitted. And through inhalation, those are mains while how diseases are transmitted. And for these things to be established in your body, you have to be a susceptible host. That means you have to be vulnerable. You have to, in some cases, some of the things that makes us easy host for this disease is when we have low immunity. Sometimes when we have I mean, the elderly people are more vulnerable to diseases because their immunity is low, and when when you're not feeding well, when you're malnourished too, your vitamins, you're not eating balanced diet, those will lower your immunity. And if you have underlying diseases too, those things can make you susceptible to illness. All right. And when the improper use of medication, self-medication is a very common thing in Nigeria, is also one of those things that makes us open to illnesses. Okay, so I believe with all this information now, ways how you can be susceptible, how you need to prevent yourself, from getting all this infection. So as a healthcare worker, as a healthcare assistant, you have to be mindful of all these things. Okay, now you have to know what causes healthcare associated infection. There are millions of microorganisms, in the air, in the water, we have to be mindful of all these things. It's important to understand the difference between most common types of microorganisms, how to prevent them, especially by washing our hands, and all those things. By washing our hands, we stand a chance of preventing a lot of infection, okay, because our hands are the major carriers of this infection. A proper hand washing technique will help us reduce and possibly eliminate the transfer of infection from one person to the other. Okay, another way of transfer is insufficiently clean medical equipment. You have to ensure that as a healthcare assistant, you observe proper cleaning protocol of medical equipment and your environment, because failure to adhere to these prevention policies can lead to spread of infection. Okay, because infection prevention and control is everyone's responsibility, and so you must undergo effective hand washing technique every time before and after you touch your service user, that is your patient. You must also use your personal protective equipment, that's a PPE. Okay, proper handling and cleaning of medical equipment and devices. These are ways to prevent spread of infection, okay? And it's going to be your daily habit, all right? Every day in your daily routine, you must effectively wash your hands. You must use your personal protective equipment when necessary, whenever you before you go close to someone that is probably on isolation or person you are taking care of. You have to prevent transfer from you to the person or from the person to yourself. You have to rapidly, you have to be vigilant. You have to rapidly identify the presence of infection. When you are taking care of someone, when you notice the slightest changes in their response, you have to be observant and vigilant, okay, so that you can quickly take action, so that isolated infected patients or residents, you can quickly put them in an isolation if you have discovered that they've become infected. That is after you've done maybe any slight any situation where you observe changes in their health. You immediately raise alarm so that immediately they will be isolated, and then the test will be done for them. You also have to ensure that patients or residents and their visitors are educated about infection prevention practices within the healthcare environment. Okay, you have to also maintain personal hygienic practices just to ensure that everyone complies with the local policy, of keeping everywhere infection free. Okay, now there are some infection illnesses that are common in the healthcare setting. All right, now in the care home where you're working, there are some very, very important infectious illnesses you have to be aware of. That is diarrhea and vomiting. You also have to take note of chest infection, then flu and COVID-19 type infection. Okay, these are things you have to take note. If you are working in a COVID ward, you have to take extra precaution wearing your PPE effectively, so that you can prevent yourself from any kind of exposure to the infection. All right, even if you are vaccinated, you have to take precaution to prevent yourself and people around you. All right, so these are things you must do because it's very essential so that you will not fall, you will not be down to any of these sicknesses. So in the course of your duty, you'll be taking care of people that are sick. So you also have to protect yourself. All right, very, very important. Okay, you have to, number one, when you are washing your hand, you have to use soap and water, and when your hand is visibly dirty, you must use soap and water. Because what you can see with your hand is that it's dirty. So you have to use soap and water. Then when you are looking at your hands and it's not looking dirty, you have to make sure you use a hand sanitizer, so that you are sure that your hands are obviously clean. Okay, it's very important that we know how to manage and dispose clinical waste. All right, this is very important part of our job. Okay, during your interview, you may be asked, how do you dispose an infectious or contaminated waste? Okay, you need to understand that for every item that you want to dispose, there are different colors of disposal bags that identifies with a particular type of waste. Okay, now for example, if you are disposing an infectious waste, it has to be in the yellow bag. An infectious waste is a waste that is infectious. It carries maybe a form of, it's probably, for example, if you are disposing hand gloves that was used to care for somebody in the COVID ward, or caring for somebody that has diarrhea, it must be in the yellow bag. Any item that is infectious must go in the yellow bag. All right, if an item is from the kitchen, obviously, like we said in our previous training, it will be in the black bag. All right, and if an item has to be treated to render safe, if an item has to be treated before it's put into the yellow bag, it has to be in the orange bag. All right, if an infectious waste, has to be treated before it's being disposed, it has to be in the orange bag. That is very important. All right, now cleaning and decontamination. A dirty or contaminated clinical environment is one of the factors all right, that contributes to hospital-related infection. So it's important that we clean, disinfect, and sterilize our environment. Very important. Okay, these are things that you need to do when you are working, in the healthcare setting. And the storage, handling, and bagging of linens that are used in a hospital setting must be done effectively. Okay, when you are handling all these things, you must wear your PPE and your gloves, because you don't want to contaminate yourself or people around you. Okay, now when you are in a hospital setting, washing your hands is very important. Whenever you are about to attend to your patient, make sure you wash your hands. And then, to be able to wash your hands effectively, you must prevent unnecessary things from your wrists. Okay, avoid wearing wristbands. You don't need to wear wristbands, when you're walking, so that that wristband can carry infection. You don't need to wear wristwatch. You don't need to wear any jewelry, and you must avoid long nails. You will remove your wedding ring, any type of fashion ring. Avoid wearing them when you are walking, because bacteria can hide in all of these things. Okay, it's advisable that when you are walking, you don't wear any long nails. Okay, no fashion nails, no slay queen or slay mama nails. All right, when you are working as a healthcare assistant. So you also wear very short sleeve, because if your sleeve is long, there's likelihood that it can come in contact, while you are working with an infected object. So it's better you are on short sleeve. So this is how you go about your daily work. All right. So whenever you are working and you notice that there's likelihood that you must have caught any type of infection, you must tell your manager, so that you can isolate and get treatment before you return to work. It is very important, so that you don't bring infection from home to work, or vice versa. All right, those are very important things you must know, because you might be asked during your interview that, oh, you are working and you discover that you are not feeling fine. Will you manage to go to work? Because you know that your presence is needed at work. Your response should be that you are not going to go because you are not feeling too well. You call your manager and let them know you are not feeling well. Okay, the importance of doing that is to prevent you from bringing any form of illness to your colleagues at work. All right, so moving on, it's important that we also know that there are different points of entry. Okay, you may be asked that in doing your interview, for example, that what is the chain of infection? Now, the chain of infection is simply how pathogenic microorganisms are transmitted from one person to another. All right, how pathogenic microorganisms are transmitted from one person to another. The chain of infection is made up of 6 different links that allow pathogenic microorganisms to be transmitted from one person to another. If one of the links in the chain is broken, the infection will fail to spread to the other person. So for an infection to effectively move from point A to point D or point F, is determined by the successful movement from one point to the other. All right. So this, for infection to be complete, it has to move from one point to the other, from the source, through the mode of transmission, whether by air, whether by physical contact, all these things has to be complete for an infection to be complete. And that is when the person becomes down with symptoms. All right. This is very important, so that in the course of your interview, you have to be alert, very alert to your interviewer when you're trying to know how well you understand infection and disease. Okay, because infection and disease in reality is very, very important, because in the course of your interview, they want to know how well you understand infection control. In the display of your work, how well are you able to manage, for example, when a patient vomits, you have to use the right cleaning equipment. Every equipment is labeled. There's a yellow bucket, there's a yellow mop. You have to use only the yellow mop and only the yellow bucket when you are cleaning a bodily fluid. Okay, for example, you might be asked, a patient vomited in the hallway. What do you do? First of all, you must identify that is a bodily fluid waste. You cannot use the mop that is being used in the kitchen to come and clean. Because it happened in the kitchen doesn't mean, or it happened in the hallway doesn't mean you will use the mop that they use in the hallway. Okay, you have to use the appropriate mop, which is the yellow, the colored coding, which is yellow for infectious bodily waste cleaning. Okay, so every procedure has the appropriate approach, appropriate response. Okay, when you are cleaning, the same way when you are disposing items that, like maybe a soiled pad, for example, you have to put in the yellow bag. Okay, because it is soiled, and it's, of course, it has to be handled in such a way because it can spread infection. All right, you have to make sure you wear your gloves when you are handling infected soiled linen. Okay, so these are the responses you would give if you are confronted with such questions during your interview. Okay, it's important that you are able to let your interviewer know that you have an understanding that in a healthcare setting, there are procedures, there are ways of managing infectious items so that you can protect yourself and protect your patient. All right, thank you all for listening to this video, and I hope that you at the end you have been able to understand that when you are confronted with questions by your interviewer about infectious disease and control, you're able to let them know that you have an understanding. You know that there are ways of handling different items. In the hospital setting, there are color codings. You have the red bag, the yellow bag, and of course, in course of disposing every item, the appropriate colored bags, color code, to dispose every item. Like I said earlier, the yellow bag is for infectious items. You dispose effectively, and if you have the clinical waste also, you know how to dispose them effectively. Okay. In the course of your role, once you get the job, you go through induction where you will see effectively how you are expected to handle. You are not going to be dealing with items that are infectious without wearing gloves. It's very important because your hands are basically the mode of transfer of diseases by contact. Okay, so you have to avoid touching. You have to wear your gloves and dispose them appropriately. Okay, very important. And make sure you don't wear your gloves, you don't wear your apron after you have attended to a patient. You make sure you remove it where you are. Don't take it to other places where you can spread. Carry the apron to areas where you can spread infections further. You remove your apron and wash your hands appropriately, and then dispose them effectively. All right, thank you all for watching this video. We'll continue with the next video where we'll be teaching you more about the other topics that are important for you so that you can do well during your interview. Thank you for watching this one, and have a nice day.